Hello everyone, this is Annie the pharmacist. Welcome back to my YouTube channel. Today we'll be discussing cervical cancer. So what is the cervix? The cervix is the lower narrow end of the uterus, also known as the womb. And cervical cancer start in the cells of the cervix, growing slowly over time. Before cancer appears, abnormal cells begin to appear in cervical tissue. If these cells are not destroyed or removed, they turn into cancer. And they grow and they spread more deeply into the cervix and the surrounding areas. Now, the cervix has two parts. You have the ectocervix. So, ecto meaning the outer part, and this consists of thin, flat cells called squamous cells. And you have the endocervix, which is the inner part, and that connects the V to the uterus, also known as the womb. And I'll be saying V because I don't want YouTube to remove my video. So it connects the V to the womb, and this consists of column-shaped cells called glandular cells. And these cells also make mucus. Now you have the squamo-columnar junction. And as it sounds, junction is where two or more things meet. So the squamo-columnar junction is the border where both the ectocervix and the endocervix meet. And this is where most cervical cancer occurs. You have 90% of cancer developing in the ectocervix. And they remember they consist of squamous cells, so it's called squamous cell carcinoma. That's what the cancer is called. Now in the endocervix, cancer do develop there, but it's very rare. And these are glandular cells, but they are called adenocarcinoma. So when cancer develops in the endocervix, which is rare, it's called adenocarcinoma. Now, some of the early symptoms that you should look out for, definitely do not ignore them, is V bleeding after sex. So you have the V bleeding after sex. You also have the V bleeding sometimes after menopause. You also have it bleeding between periods, or period may be heavier or longer than normal. Also, watery discharge that has a strong odor or contains blood in it. You may also have pelvic pain or pain during sex or intercourse. Now, the more advanced symptoms that you can look out for is if you have difficult or painful bowel movements. So when you start having problems with bowel movements or bleeding from the rectum, if you don't have hemorrhoids and you're bleeding from the rectum, you can look out for that. Difficult or painful urination or blood in the urine. Also, you may have a dull backache that just won't go away. You may have swelling in the legs, pain in the abdomen, or you may be feeling tired. Now, the screening that they do for that is a pap smear, which is recommended every 3 years, starting at age 21. You can sometimes have false positive, as well as you can have false negative. So if you know you're having all these symptoms or some of them and you're concerned, make sure your test comes back as a false positive. There are follow-up tests that can be done, which is it's called a colposcopy. And this is just basically a lighted magnifying instrument that is used to widen the V so they can easily see this inside the cervix and examine there. Also, tissue samples can be taken with a spoon-like object and be checked under a microscope to make sure that it's not a false positive. Okay, so as usual, prevention is better than cure. So get your regular checkups, and for the ladies, do not take these signs lightly. Do not ignore them. Pay attention attention to your body, right? No one knows your body more than you do. So if you see something, do not take it lightly. For the men, you all have ladies in your lives, whether it be your mother, your sister, your daughter, your aunts, cousins, etc. Right? You could possibly save someone's life. So listen to this video and share it with them. Have a good day. And as usual, if you have questions, feel free to comment, leave comments in the comment section, like, subscribe, and share. And you do have a good day.